Hi everybody, this is James here from Malloy's Pharmacist today, and what we're going to talk about is something that I come across quite a lot is urinary tract infections, and most specifically cystitis. Cystitis is a urinary tract infection is a kind of an umbrella, and then underneath that you've got different forms of infection like pyelonephritis, which happens in the kidney, and then you've got cystitis, which is in the bladder. And this is quite common, especially among ladies. And usually what we find is with infections of the urinary tract, symptoms that actually occur are usually an urgency to urinate, frequency of urination, and also a cloudiness of the urine. You can also sometimes get a pain in the back, but this is usually to do with the kidney, which is more to do with what's called pyelonephritis. What are the causes of this? Well, usually the causes are infection, usually caused by a bacteria called E. coli. And that can happen post-sexual intercourse, or also if you're having an incorrect cleaning. And what I mean by that is cleaning from back to front rather than front to back. If you are getting recurrent UTIs, especially with cystitis, you need to talk to your doctor. However, the treatment is usually with an antibiotic, which are usually very, very effective. But to also help that, especially if you haven't got access to an antibiotic, you can use something like cystopurin, which is very, very effective. You can also use cranberry juice. The one thing I'd say about cranberry juice is to be careful if you're taking warfarin. There are papers out there that suggest that it could have an interaction with warfarin. And the other particular product is D-mannose, which is a complex sugar. And basically all of these products make it very inhospitable in the bladder area for bacteria to survive. So by taking one of these products, it can help on its own, but it can also help very effectively with an antibiotic. The one thing I would say, especially with ladies, cystitis is very manageable and it can be well controlled. But usually with UTIs or cystitis with men, I always recommend go to your GP, and that is really, really important. Okay, if you have any more questions or anything like that, just put them on our platforms and we'll do our best to answer them. Have a good day.